Hello, everybody. Thank you for partaking in our webinar. We are trying out this time a slightly different format from what we usually do in our webinars. And we have Dr. Anderson giving a little brief review of his opinion of cases and also in context with Lyme and chronic illnesses. He's specialized in that as well. And he uses tools from both worlds, the conventional and also the integrative medicine in his practice. He focuses on Lyme and developed a deeper understanding of chronic illness and its treatment and frontiers that are still there to be discovered and also possible solutions.
My 30 years of dealing with these chronic infections, I've been very skeptical about the laboratory results that I've gotten and have not relied on them. So I'm a laboratory skeptic, but this Infectolab is changing my way of appreciating the efficiency of labs. They've got something going here that's very, very important. All right. So I'm going to talk about 3 different categories quickly because I think we're probably running short on time. So basically, the Infectolab has helped me to know where do I start, when do I stop, and helping me to sort out the viral issues for our patients. So in the very beginning in the 90s, we had this idea of a full court press. We treated everything all at once, and we did 5 different antibiotics, and a few people survived that. Maybe 10%, 15% of people got better with that approach. The rest of the people, it blew them out of the water. And so I gradually developed a system of treatment where I appreciated that the immune system was like this great triage nurse, and he or she was scanning the body and looking for what the most threatening pathogen was for the system. I completely agree with Dr. Gordon's comment. It's never about one pathogen. It's always an accumulation of pathogens, and they're all intermingling, and so many of them share similar symptoms. And in the moment, the immune system is telling us what it needs to do through the symptomatic presentation. So teaming up those symptoms with the pathogens helped me to appreciate, tuning into those symptoms helped me appreciate what needed to be treated first. And as I was able to peel that off and weaken that dominant pathogen, then the immune system would reprioritize. This is the story that I told myself about it. This immune system would reprioritize and come up with another focus, and that would have a different symptom presentations, often slightly different, but different enough to be able to tell the difference. The Infectolab has given me results that reflect this way of thinking. It's very important in how we deal with these infections, because in my experience, if we go at one pathogen at a time and treat the most dominant pathogen and then the secondary pathogens, that's the quickest way through treatment. When we try to overload the immune system with doing too much at a time, or doing a treatment that is an underlying treatment and trying to go through the other pathogens to get at that underlying pathogen, it's less efficient, and it creates more Herx reactions. It creates more side effects to whatever the method we're using. So here's some examples. So this is a patient that I'm in the middle of treatment, and I've treated her for Babesia, and it looks like we successfully treated her for Babesia with her interferon gamma being low and her interleukin-2s, her central memory T cells being high. That looks like a resolved infection. We're currently in the process of treating her for Bartonella, and that looks like it's working. The interleukin-2s are rising, and they're almost equal to the Bartonella. And then we haven't treated the Lyme yet, but that's definitely positive also, with the interferon gamma being positive over the interleukin-2s. So a little bit more Bartonella treatment for her. And then once that's cleared, then it's going to be about Lyme treatment. So the Infectolab, I saw this, but the Infectolab confirmed it for me that Babesia was gone, Bartonella was here and almost resolved, and Borrelia was coming. Okay, and here's another person. Let me remind myself who this is. This is a 65-year-old woman, and she was successfully treated about 5 years ago. She did pretty well for 5 years or so, and then she came back with what appeared possibly to be a relapse, and she was exhausted with tremendous post-exertional fatigue. She was sleeping 12 hours a day and had a dry chronic cough. So running the Infectolab on her showed us that it looks like what we had done in the past is sticking, with the Borrelia being, the interferon gamma being low, the interleukin-2s being higher, the Bartonella, the Babesia being the same, the Bartonella a little bit positive, borderline positive. Do I consider that an actionable when the interferon gamma is in this borderline category? I can't make that call with the lab, so I'm going to have to rely on her symptoms, but her presentation does not represent any Bartonella symptoms. So Bartonella being more painful, irritable, and less exhausted. The Bartonella patient can't sleep for 12 hours. They're much too restless and irritable. They wish they could sleep for 12 hours because they're exhausted, but they're wired. They're the wired tired. And so that leaves us with the chlamydia pneumoniae. And am I leaving anything else out? And the chlamydia pneumoniae fits her pretty darn well, with post-exertional fatigues, being exhausted, and having this dry cough. So we're in the middle of treating her for chlamydia pneumoniae right now, and we'll see how this changes over time. And next is a 62-year-old woman, and this is an interesting case because it highlights mycoplasma versus Bartonella. So it looks like she also had a Epstein-Barr early antigen being extremely high. Like, I think anything over 1 is high, and she was like 150. They stopped counting at 150. So I was really interested, is that Epstein-Barr? I usually associate that early antigen with an active Epstein-Barr infection, but according to this lab, that's not her issue. So Borrelia is positive, and Bartonella is positive, and mycoplasma is positive. So in that group, it's been my experience that you go after the most aggressive pathogen first, and that very often is Bartonella over mycoplasma. Mycoplasma, they're both painful, so it's tricky to make the call between these two. They're both painful. They both have tendon, muscle, and joint pain. The difference, and they're both surface dwellers to some extent. Bartonella is going to stay on the surface. It can be in the stomach, throat, and eyes, secondarily in the bladder and a vagina for a woman. And mycoplasma is also a surface dweller, lives on the inside of the blood vessels, also on all the mucous membrane surfaces. Bartonella is going to affect the brain much more. People aren't going to be able to think, and they're going to be much more moody and emotional, and the anger that that Nafisa mentioned is a common feature of Bartonella, where mycoplasma doesn't affect the brain as much. It affects the body more. So, so for this patient, and the mycoplasma is causes much more fatigue and exhaustion, and people sleep for 12 hours, and people with Bartonella, as we said before, they wish they could sleep that much. So given that she doesn't have those mycoplasma symptoms yet, we're going to go after Bartonella for her, and then either mycoplasma or Lyme. I might need to hurry up here. Another Bartonella mycoplasma, I'm going to skip this one because it's kind of a repeat. And then when do we stop? So when is treatment enough? Dr. Gordon brought this up as a very pertinent point. You know, as we're using antibiotics, we don't want to overtreat, cause more problems. So it's a difficult decision often to make, and there's other things involved, other pathogens involved. So the Infectolab gives me important data points to make these decisions. Here's some resolved treatment. And this person was treated for Babesia first, Bartonella, and then Lyme. And another early antigen that showed less Epstein-Barr activity, even though the early antigen was quite high. So that's a resolved case. Here's a 53-year-old and treated Bartonella and Babesia, and apparently helping the body, helping the immune system not be burdened by those two allowed it to be more effective against the Lyme. So it's looking to me like the Lyme is really almost a moot point, but I'll probably do a little herbal treatment for it just to see, even though it's a borderline reading. I'm assuming that because Lyme hides, it's not going to have as robust a response. So I do consider a borderline as interesting and should be kind of considered. And then quickly about the viruses. So viruses, as the immune system is struggling, a lot of the chronic viruses, which are usually stored in the attic in a box and sealed away, but they're always up there, they can sneak out of that box when the immune system is distracted and start wandering around and causing trouble. But the bacteria always predominates, or almost always is the dominant thing that needs to be treated first. But then the viruses percolate up, and sometimes the immune system is enough to control them, but sometimes we have to help the immune system with those. So the Infectolab has really helped me to appreciate, what do these antibody levels mean when we do antibody testing? And this person's cytomegalovirus virus was greater than 10, which is where the lab stops their IgG antibody testing. They figure, well, that's high enough. But is that active? Just like the early antigen of EBV, that early antigen, I always expected that to be an active infection. But the Infectolab is giving me information about this. Her early antigen was also very high. Epstein-Barr is not the issue. So, and she was successfully, and she's got a little Borrelia. But again, we didn't do any Lyme treatment on her. We cleaned up her Babesia and Bartonella. Oops, sorry, wrong person. So we're treating, she had borderline Bartonella and Lyme, but I'm treating her CMV. And it's another big CMV. So I'm very happy about what I've found in the Infectolab. I'm very happy that they agree with the way I think, and their labs represent this layered approach, which I think is a landmark in laboratory testing.